Chair, I can confirm we're now live.
Lovely, thank you very much for that. Good afternoon, one and all, and welcome to this meeting of the Local Outbreak Engagement Board for Bratton Forest Council on the 1st of March. I will go straight in. I think we're all aware of the etiquette and how these calls now will work and how they run. I would like to just ask if there are any apologies for any absence.
Chair, I've received apologies from Councillor Bettison, Abby Thomas and Gabby Hafner. However, as is sometimes the case, people can have problems accessing a digital meeting, so anybody who doesn't appear in the call will have their apologies recorded.
Brilliant. Thank you very much for that. We'll hold on to the move on to the roll call. Kirsten, is this on to you?
Chair, sorry, I dropped out there. Could you just repeat?
On to the roll call.
Thank you, Chair. Please alert me if you can't hear me. My internet connection is unstable. Members of the board, please turn on your microphone and confirm you're present when I call your name. Anybody who doesn't respond will be recorded as giving their apologies. Councillor Dr. Barnard.
Present.
Councillor Bettison has provided apologies. Councillor Birch.
Present.
Councillor Brunel Walker.
Present.
Andrew Hunter.
Present.
Abby Thomas has provided apologies. Kelly Williams.
Present.
Elena Rozelle.
Present.
Gabby Hafner has provided apologies. Acting Inspector Sophie Gardner. I'll record Inspector Sophie Gardner's apologies. Fiona Slevin-Brown has provided apologies. Philip Bell.
Present.
I'll run through a list of possible attendees. If you could confirm you're present. Timothy Whedon.
Present.
Stuart Lyons. Sarah Bellas. Shamaki Issa. Shamaki Issa. I can see Shamaki in the call, however, he's on mute. Councillor Mrs. Hayes. I can see Councillor Mrs. Hayes in the call. She's currently connecting to audio, so we'll come back and confirm her attendance. Councillor Harrison. Councillor Hayden. Councillor Turrell. James Sunderland MP. Adam Afria MP. Jerry Barber.
Present.
And Mary Stamp. Is there anybody else present whose name I've not called? Can I just check once again, Councillor Dorothy Hayes, are you on the call? I think she might have connection issues. Oh, I can see her on the call. Councillor Mrs. Hayes, you're on mute. I can see Councillor Mrs. Hayes is there, however, she's having trouble getting her microphone off of mute. And Shamaki Issa. Thank you, Chair. I think we're having a few problems with connectivity issues today, but I will record both of those as I can see they're on the call. Thank you.
Brilliant, thank you for that. Item 2 is declarations of interest. Do any member have any interest to declare in the meeting agenda this afternoon? If you do, put it in the chat. Great. Moving on, agenda item 3. I believe we have an urgent item of business this afternoon.
Chair, Kelly Williams, Director of Strategic Projects, has an update for the board on living with COVID.
Kelly.
Thanks, Chair. Yeah, just wanted to run through with the board today some of the changes that were announced by government last week under their new Living with COVID proposals. So I'll just share my screen now and I have a couple of slides to go through. Okay, can you see those?
Yes.
Yep, lovely. Okay, thank you. So there were 4 key dates that I'll go through. 2 of them have already passed. Sorry, go back. 2 of them have already passed and 2 of them are yet to come. So the government made their announcement on Monday of last week, which was the 21st of February, with regards to their new living with COVID plans. From the day that that announcement was made, there was the immediate removal of the guidance for both staff and students in secondary schools and for staff in primary schools to cease with immediate effect twice weekly asymptomatic testing. From Thursday of last week, or should I say from 11:59 p.m. on Wednesday of last week, a number of further changes came into effect. So the first being that from Thursday of last week, the legal requirement to self-isolate following a positive COVID test has been removed. However, it's only the legal requirement that has changed. The guidance remains the same. So any adult or child who does test positive for COVID-19 will continue to be advised to self-isolate at home and avoid contact with other people for a minimum of 5 days, and then to follow the pre-existing advice to take daily LFD tests from day 5 onwards. And if you get to the point where you receive 2 negative LFD tests in a row, at that point you can then end your self-isolation. So just to reiterate, it is only the legal requirement that has changed. The guidance and advice on public health grounds remains exactly the same. The other change that's already come into effect is that from that date last Thursday, fully vaccinated close contacts and close contacts who are under the age of 18 are no longer advised to take a daily LFD test for 7 days. So you'll recall previously all close contacts were required to self-isolate. The requirement to self-isolate was removed and replaced with a recommendation to do daily LFD tests for 7 days. That recommendation has now also been removed. So close contacts who are vaccinated and those under 18 no longer required to do a daily LFD test, although obviously very important for them to be mindful of who they mix with in terms of contact with vulnerable people, and also monitoring for any symptoms if they themselves begin to feel unwell. In addition to that, apologies, Chair, it's not on the slide, but in addition to that, those individuals who are over 18 and unvaccinated are also no longer required to self-isolate if they come into contact with a positive COVID case. Again, from the 24th of February, self-isolation support payments and national funding for practical support and the medicine delivery service are no longer available. In terms of the self-isolation support payments, there is a 42-day grace period beginning on the 24th of February for anyone who tested positive up until that date can still make a claim for the self-isolation support payment, and residents will find information about that on our website. Another point from the 24th of February, routine contact tracing has ended because there's no longer a requirement for people to self-isolate by law. Contact tracing has ended effective immediately. There's also been a change to the legal obligation for individuals to tell their employers when they are required to self-isolate. And finally, the health protection coronavirus regs have been revoked. Moving on, from the 24th of March, all of the COVID-19 provisions within both the statutory sick pay and employment and support allowance regulations will be removed. And then from the 1st of April, which is the final date on the government's roadmap, the current guidance on the voluntary use of the COVID status certification, or known to most people as the COVID pass, in domestic settings and certain venues is no longer recommended. Before the 1st of April, the government will provide some updated guidance on the ongoing steps that all individuals and people who test positive for COVID-19 should take to minimise contact with other people. And that's going to align to changes that are coming into force with regards to the current testing regimes. So with regards to those, there will, from the 1st of April, no longer be free universal provision of symptomatic and asymptomatic testing for the general public in England. So what that means is there'll no longer be free PCR tests at testing sites for people who are symptomatic, and there'll no longer be free LFD tests for people to test routinely or in high-risk situations before going out if they are asymptomatic. The government also, by the 1st of April, intends to consolidate all of the existing guidance to the public and businesses in line with current public health advice. They will remove the explicit requirement for employers to consider COVID-19 in their risk assessments. and they will replace the current working safely guidance, which is for workplaces, with new public health guidance. So those are all of the changes that are either in force or due to come into force, and happy to take any questions.
Great. Thank you for the update on that. A lot to take in with a lot of changes. I think it reflects the changing nature where we are, which is great to see after all this time. Any questions from colleagues? No? Okay, brilliant. In which case we shall move on through the agenda and we move to agenda item 4, which is an update on national and local COVID-19 status. Shamaki, are you online? Is your connection? You are there, great.
Yes, apologies for that. It's much better. Had to reset the router quickly, which was downstairs. Yeah, so what I'll do is I'll share my screen and I'll sort of switch my video off in case the connection goes off again, but you'll be able to hear me as I go through the slides. So I'll just share my screen. Hopefully you are all able to see that.
Yep.
Okay, so I'll just sort of begin the slide. So welcome to the latest EPI update for the local outbreak engagement board. So going through the situational awareness. So for the period 17th to 23rd of February, which is the latest period we have data for, the individuals tested per 100,000 has continued to decrease in Bracknell Forest, as well as in Berkshire, the southeast in England. And at the moment, 225 people per 100,000 in Bracknell Forest are being tested with PCR. In terms of the percentage individuals testing positive after taking a PCR test, that's also continued to go down to 14. As you could remember from the previous local outbreak engagement board, we were reporting numbers as high as 35% of individuals testing with PCR testing positive. That's now down significantly back to the numbers that we were seeing back in September, October, so around 14% of individuals, which is still quite high given the which is indicated by the red color of the individual field, but that's significantly lower than before. Similar picture if we actually look at the cases per 100,000 population for total population, and we're seeing that there's been a quite significant decrease to 417 cases per 100,000. As you remember from previous local outbreak engagement boards in January and December, we were starting to look at numbers well over 1,500 cases per 100,000. So at 417, we're starting to sort of go back in terms of number of cases to what we were seeing previously about 4 or 5 months ago. Numbers are still quite high in terms of cases per 100,000, 60 plus population, but that's another one where in both Bracknell Forest as well as nationally, regionally, as well as in Berkshire, we're seeing numbers go down week to week. That's now at 377 cases per 100,000 in this age group. If you look at the table below, where we break down first infections and reinfection in terms of number of cases, this information is presented because the Omicron variant, unlike the previous variant, had quite a high proportion of individuals getting reinfected. So what we're seeing for the month of February up until the 23rd of February, that the percentage of cases for first infections and reinfections quite stable in that 91 to 93% of cases are individuals who are being infected for the first time with COVID, whereas up to 9% of individuals are reinfections. Looking at situational awareness map, providing the case rates per 100,000 for the not just Berkshire local authorities, but also the adjoining local authorities. We're seeing that the cases are lowest in the East Berkshire region, where we're looking at cases of less than 550 per 100,000, indicated by the lighter colors. And as we move towards the west, Woking and Reading and West Berkshire, we're seeing a higher number of cases, with the highest numbers of cases at the 17th of February in West Berkshire. Generally what we're seeing is, again, regionally quite a different picture than from the previous local outbreak engagement board, where we were seeing this actual key being quite different than looking at cases well over 1,600 per 100,000 population. So if you continue looking at situation awareness, but this time just for Berkshire, we're seeing the case rates for Berkshire at the 23rd of February at 430.3 cases per 100,000. This is a trend that's continuously showing decreases, 29% on the week before and 53% on the week before that. And if we look at the graph, we are seeing that after the initial Omicron spike and a second spike after changes to COVID reporting where reinfections were included in the data, that there's been a steady decline, not just at Berkshire level, but also southeastern England, as we're starting to go back to the number of cases that we were seeing earlier last year. Looking at the epidemiology of cases in the Berkshire local authorities, where we see the individual graphs seen earlier, but then for the local authorities, we're seeing that the decreases aren't driven by one individual local authority, but rather across the board in all 6 of the Berkshire local authorities, decreases that are equivalent to the ones seen in the southeast as well as England. So the overall picture is that after the initial Omicron and the changes in data reporting spikes, we are now seeing gradual decreases for each of the local authorities. Looking at a map of Bracknell Forest and looking at to sort of have a look at the case rates within each of the wards, we are seeing that there's quite a uniform picture, and that at the 17th of February, the number of cases were under 800 per 100,000, so between 400 and 800, with the only specific ward sticking out being Wild Ridings Central Ward, posting 834 cases per 100,000. If anyone's interested in actually looking at the case rates since the actual start of the pandemic and for the week 11th to 17th of February for the individual wards, you can find that on this slide. So we're looking at the case rates by age groups, starting up with the heat map for the individual age categories. We're starting to see quite a different picture. So if you could remember from the last local outbreak engagement board, we saw that this entire map was essentially dark red because of the high number of cases, but now we're starting to see the lighter colors come in that are equivalent to the lower number of cases within the age groups, particularly in the younger ones. A more specific breakdown for the case rates by age category from the up until the 23rd of February compared to the last time this was looked at, which was the 15th of February. We're seeing that significant decrease in the individual age categories for both Bracknell Forest as well as the southeast, with some of the higher increases seen in the older ages. I must note though, because of the smaller population and the lower number of cases in general, in the older populations, the week-to-week changes, so increases by 20 or 30 cases generally represent as significant increases in terms of percentage. But overall, what we're seeing is that similar numbers within individual case in individual categories, up to a maximum of 600 cases per 100,000 seen within the individual age category. So overall, as indicated by the green colors, decreases in almost all of the age categories. Moving on, hospital activities and deaths, for the number of individual patients admitted to the Frimley Health Hospital, as well as the individuals who are currently inpatients in the hospital with COVID-19, those numbers over the past month are decreasing. If we look at the 7-day average for admissions and 7-day average for COVID-19 inpatients, so on the 22nd of February, there were only 8 new COVID-19 admissions to the hospital, while on the same date, there were only 98 patients in the Frimley Health Foundation Trust hospitals with COVID-19 and only 2 patients on mechanical ventilation due to COVID-19. If you look at the number of deaths in the last week ending 18th of February, there were no new deaths recorded, and a total number of deaths related to COVID-19 within Bracknell Forest are 220. Looking at the overall picture for vaccination, not much change really from the last time. If we actually look at dose 1 and dose 2 coverage for the population, Bracknell Forest are at 81% for the total population, 84% having had dose 1 and 2, in the 18 plus population, which sort of puts us right in the middle when it comes to our local authorities. But as was the case for the last 6 or 7 months, we are outperforming both the southeast overall and England overall numbers. If we go and look at the table up here, which is looking at coverage for individuals who had those 3 boosters, that's where we are seeing quite significant gains, particularly in younger age groups. And we're seeing that in a total 50+ population Bracknell Forest, 87% of individuals having had a booster. That number is 64% in the total population, which is reflective of the fact that in the younger age categories, there's still some way to go to get those higher number of boosters. And if we compare those numbers to the local authority neighbours, we're very much sort of in the middle, outperforming some of the local authorities, but not doing as well as West Berkshire, for example. But again, compared to the South East England, we are doing much better for both those age groups. Included a table here which breaks it down with slightly more recent data. So at the 1st of March, we are seeing that where we are seeing real gains in terms of the percentage increases for coverage in the age groups are in those 3 boosters, 16, 17 to 30 and 34, as well as what significantly sticks out is that 16, 17 group and getting their boosters. And we're also seeing for those 2 continued increases at a 12 to 15, 16 to 17, who over the past few months have been eligible to get their dose 2s. Other than that, we're seeing overall very minor increases, suggesting that we're starting to sort of level out in terms of the number of individuals interested and still needing to get vaccinations. Finally, I've included both on this slide a chart that breaks down the vaccine status for individuals 12 and over in Bracknell Forest, where we're seeing that the unvaccinated population continuing decreasing in all the age categories and starting to decrease as well in the younger age categories. We're seeing individuals who have had dose 1, 2, and dose 3 or a booster increasing, actually starting to become the majority of individuals in the individual age categories, and the number of individuals who only had a dose 1 or only in dose 1 and 2 also decreasing as we go down the age categories. The last slide has a map which pinpoints the percentage vaccinated by individual wards. So that's individuals aged 12 and over who've had dose 1, 2 and a booster. We're seeing that the highest numbers are seen in Binfield and Warfield. For most of the borough, we're seeing similar numbers in the range of 60 to 69%, with the lowest numbers so generally within 50 to 59% of individuals having had dose 1, 2, 3 or a booster in the central parts, such as Wild Ridings and Central Ward. Finally, if you wanted to have more information on data thresholds, so the colors used to mark out the individual situational awareness numbers, as well as some more information on living with COVID-19, which my colleague Kelly Williams has already presented on. You can find that information here at the end of the slide. That concludes my presentation. If there are any questions, I'm happy to answer them.
Great, and thank you very much for that really detailed run through of the numbers. It's great to see that other colours are beginning to reappear on the chart.
Yes.
For the last few weeks, it's just been purple.
Before you know it, it'll be all green.
And we all long for that day, and we'll celebrate when it happens. And it's great to see those numbers shift in terms of vaccinations and the groups. And I think it's right that we don't lose sight of the fact that a small cohort of people, if 1 or 2 of them get infected, it will look like a huge percentage. But it's great to see those numbers change and actually returning back to colours that we haven't seen for a while on the chart. Colleagues, any questions? Andrew.
Yeah, just a quick one. On the reinfection rates, I think we were around between 8 and 9%. Is that sort of consistent with the national average, or are we lower, higher? Do you know?
I haven't actually specifically looked at the national average, but what I do remember is that it was up to sort of 10% the previous month. I'm not entirely sure what the exact number is now, but generally it has been stable since those numbers were recorded, where it is between 7 to 9% of individuals being those who've had a previous COVID-19 infection with any variant and then were reinfected. I think the important thing to also consider about the specific data as it pertains to reinfections is that it's only started to sort of being included in the reporting data since the 31st of January, I believe. So I'm not entirely sure whether or not this is in line with the reinfection rates in December, for example, previously, but generally it has been stable between that just under 10%.
Great, thanks.
Any more questions? No, in which case, thank you very much indeed for the detailed update.
Thank you.
And we will move on through the agenda to agenda item 5. Elena.
Thank you, Chair. Let me just share my screen with you. 2 seconds. Can you see that?
Yep.
Perfect. So I'm just trying to make it a little bigger for you. There we go. So the comms and marketing update for March is really talking about how we've moved from communicating the restrictions to actually the end of restrictions and now living with COVID. But you can see from the images on the right hand side there that actually we are saying to people that while restrictions have ended, it's still with us, and it means that we shouldn't ignore it. So that the best practice messages around health and hygiene, like hands, face, coverings when you're going to places that are unfamiliar to you or with people that you don't normally mix with, letting fresh airing and respecting other people's choices if they want to wear a face covering, you know, that kind of thing has actually become really, really important. So we're continuing with those messages in line with the government's messages as well and getting those out locally. You can see from the second bullet point there that we've put those across both digital channels and traditional channels in the press as well. And we're due to send some information out to every household across the borough in the town and country spring edition, which will be going out in April. We've also added some information to our website on current related benefits to COVID-19. I think there was some confusion certainly a couple of weeks ago as to who was eligible for what and which businesses were eligible for what. So we've just tried to make that as clear as possible. In terms of testing, it's a little bit confusing at the moment, I think, for some of our residents as to know what's happening with testing. As we've heard from previous presentations, it looks like it's wrapping up towards sort of April. So we are working with our local team to understand what messages we need to put out to people and when, and what testing will look like post April the 1st. We will get that information out as soon as we can. We are working on that. And what that means for people in encouraging positive behaviour change in terms of the hand washing and that kind of stuff, and still staying at home when you're poorly. If you're poorly, make sure you stay at home. The focus now really moving away from testing is around vaccination being the best form of protection against the virus, as well as those positive health and hygiene messages as well. For vaccinations, we've continued to promote the walk-in clinics at Waitrose and the importance of getting your first, second and booster jabs, and that it's still not too late if you haven't had your first or your second jab, that you can still go and get it. And we've been making that available through both digital and print channels as well to try and maximise that coverage as we start to adapt with living with COVID. The vaccination bus that was in the borough in February was a real success. We've promoted that via digital and printed advertisements and also through marketing, sort of on the ground marketing. And our engagement team were really key in getting that information out to specific communities who've been a little bit hesitant about the vaccination and actually needed that further discussion with specialists and with health professionals. I'll come on to some of the results from that later in the presentation, but actually it worked really well for us. So we're quite proud of that work and the results from that. A new campaign that we're just in the middle of setting up is called Pondering the Pandemic. So to reinforce those positive behaviour changes that we're all having to live with in terms of hand washing and keeping ourselves and our loved ones safe, we want to speak to people that are living in the borough, our staff, our partners, to form a real mix of video and images and pull out quotes that we can use as we start to adapt to living with COVID, just to reinforce actually how those positive changes can make our lives a little bit safer from the virus. So talking to people about why they've decided to have the booster, for example, or why they continue to wear face coverings. We'll be sharing those across different channels as we go through to the adaptation to living with COVID. In terms of our engagement team, they've been really busy across the past month. They've progressed the use of Facebook to reach a wider network of groups and demographics, and they now are in regular contact with some Gypsy Roma traveller contacts who are now sharing that information personally with their contacts and their communities about how to keep safe and what the vaccination means and why they should consider having it. They've made some further links with some Bulgarian groups in Sandhurst, some younger Romanian people, and some people in Polish support groups across social media. And they've also made some further links with some African communities in Bracknell Forest as well, which enables us to speak directly to those people and understand why they might be feeling a little bit hesitant about vaccination, how we can help them, and how we can move forward. In terms of the vaccination bus here, I've just put some of the results on there, which we were very proud of. It seems like a small number that 238 people were vaccinated across 8 days, but when you look at the figures that Shamake presented earlier on, we're actually getting to the point where that's actually quite a high number of people who haven't been vaccinated. So we were really pleased that those people came forward and had that discussion with health professionals and made that decision to get vaccinated. The majority of people as well were under 45 and 25% identified as a BAME background. So again, they are demographics that we are trying to reach. So that campaign worked really successfully, and it's something that we are going to discuss with health colleagues as to whether we could repeat that again in the future as well. That's it from me, but happy to take any questions.
Great, thank you very much indeed. Colleagues, any questions? No, I see none. Great. Elena, thank you, and thanks for the updates and for the continued messaging and keeping it fresh and relevant for our residents. It's particularly great to see that the engagement with the Roma community and some of the other harder reach communities is working, and to see that message being shared by them personally, I think that's a great sign. So well done for all of those that are involved in that. I'm going to move on to the next item if there's no more questions. Brilliant. Okay. Anything under agenda item 6 of public participation?
Chair, no questions have been submitted to the committee Dropbox in advance of the meeting.
Great, thank you. So agenda item 7, and there are a couple of items that we'll be just removing or deferring, sorry. One is we're going to defer the update on the terms of reference to the next meeting, and talking about the next date of the next meeting, we're going to be deferring the updated schedule of meetings to that next meeting date as well. I think that's the 2 items we're deferring from that. Yes, that's fine. Kirsten, over to you on anything else on this item.
We've just got a couple of open items on the action log. The first item is all board members to notify the board of any false or fake news so that it can be addressed and countered with accurate information. Are there any updates from any board members, anything that needs to be raised at this particular meeting?
I think we're seeing less and less as this moves on now. I think it's more people are fed up with the stupidity of others that are making the level of fake vaccine coverage out there is reducing. There's still some pockets. Nothing from me other than that.
Thank you, Chair. And then the last open item was an item that was relating to sort of a central vaccine information hub. And I believe Elena has an update for that item.
Yeah, thanks, Kirstine. Yeah, we did look into whether there was a central or local sort of hub for COVID testing and vaccinations. There didn't appear to be anything, so there wasn't anything that we could really use to promote that. We also looked at whether we could send information out ourselves about, queue times where pharmacies were running out of tests, but we decided that actually as soon as we got that information out, it probably would be outdated and probably cause more frustration. So what we did instead was we started promoting the various ways people could get tests, including home delivery. So if people had mobility concerns, they could order a test online and not have to go out and be disappointed that when they got to the pharmacy, they'd run out. And we also started promoting when our own community collect signs have run out of tests, so people didn't have a wasted journey. in terms of vaccinations, we did promote the walk-ins and we continue to do that, but we've also been letting people know how they can actually book a specific appointment online, so they can go and turn up at that point in time and know that they're going to have their vaccination at that time of the day. So hopefully that should cover off some of the concerns that were raised at the previous board.
Great. Anything else on this topic or on this agenda item?
Nothing on this agenda item, just except to remark that because we've postponed the approval of the revised meeting schedule, that the next meeting will be Tuesday, the 5th of April. Thank you, Chair.
Brilliant. Thanks for that. Any other topics to raise on the call today? No, in which case I'd like to thank everyone.
Mark, can I just come in? Sorry, on that. Given that where we've got to with the national situation now, that whether it's actually worth extending the meeting schedule for the outbreak board and move into a bi-monthly now. We can always call meetings should anything happen that changes, if there's a new variant or something like that. But I think that it would probably be more appropriate to go to every 2 months now.
I totally agree with that. We've always got the option of being able to call a more urgent one. I'm easy on whether it's every 2 months or every 3 months. I'll leave that to others to decide. But I don't think having a monthly meeting for the sake of having a monthly meeting is relevant anymore, whilst the numbers are hopefully continuing to move on the right direction. So Tim, I'd leave it to you and the views of others, but every 2 months, every 3 months, and then call meetings as and when needed to do it will also reduce the burden on officers and presentations, etc.
Okay, thank you.
Anything else? Great, thank you one and all, and declare this meeting closed